Hey everyone, welcome to this next mini lesson on the GI system. This time we're going to look at the mouth, the pharynx, and the esophagus, some structures and functions, and some disorders. So let's look at the mouth and mastication. So the mouth we refer to as the oral cavity. It's the entrance to the digestive tract and the first site of mechanical digestion through the process of mastication, or what we refer to as chewing. Be very careful how you pronounce mastication. That's the medical term for chewing. So mastication results in mechanical digestion and also some chemical digestion. We have buccinator muscles. Those muscles are located in the cheeks. The main buccinator muscle is the masseter muscle located in the cheek. It helps to close the mouth. The palate is the roof of the mouth. We have the hard palate and the soft palate. The hard palate has ridges along the top. Those ridges are called rugae. We see rugae in other structures as well. Rugae just means folds. So places like the stomach and the bladder that fold and then expand have those ridges as well, called rugae. The hard palate doesn't expand, but it has those ridges along it as well. And then the uvula is an extension of the soft palate, and that helps to close off the nasopharynx when we swallow. So that's the uvula, the little hanging down thing in the back of the soft palate. The tongue is located in the mouth. Obviously, it helps move food around. It helps the cheeks and the lips and the gums hold food in place while you chew. The small, rough ridges on the tongue are called the papillae, and they contain the taste buds. And the taste buds obviously help give us the sensation of taste. And taste buds usually live for around 7 to 10 days before they are replaced. This picture is also showing us the placement of the tonsils, which are just masses of lymphatic tissue. So you'll see lingual tonsils, which are at the back of the tongue. Lingual refers to tongue. And then palatine tonsils, which are on either side in the posterior aspect of the tongue. In the mouth, obviously it's where we have our adult teeth. We have 32 teeth, 16 on the top and 16 on the bottom. The upper jaw is referred to as the maxilla. The lower jaw is the mandible. The mandible is the only movable jaw in the skull. The teeth are the hardest structures in the body, and the teeth have different shapes based on their function. So the incisors in the front are shaped like a chisel, and they're meant to slice and cut into food. The cuspids, the word cusp means point. The cuspids have points, and they're on either side of the incisors, and they're made for puncturing and tearing. And on either side of the cuspids, we have bicuspids. Remember, bi means two. So these teeth have 2 points. And then behind the cuspids, we have molars. And the molars have flattened surfaces, and those are meant for grinding and crushing foods. We also have wisdom teeth, and wisdom teeth are basically molars. Each tooth has 2 main parts. We have the crown of the tooth, which projects above the gum line. That's the part of the tooth that we see. And the crown is covered in enamel. That's the hardest substance in the body. And then the root of the tooth is embedded in the jaw, so we don't see the root of the tooth. The bulk of the tooth is composed of dentin, and that's a substance kind of like bone, but it's harder. And that dentin surrounds the pulp cavity, that's the inside, and that pulp cavity contains nerves and blood vessels. And you've probably heard of a root canal. So the root of the tooth is that part that's embedded in the jaw. And those root canals, that allows the blood vessels to travel up from the jawbone into that pulp cavity. The gingiva is the soft pink tissue that surrounds the tooth, what we commonly call the gums. So you may have heard of the term gingivitis. That's inflammation of the gingiva or the gums, and what we commonly refer to as gum disease. The periodontal region is the complete area around the tooth that surrounds the gum region and the entire area there. So this kind of gives you a picture of the overall bottom portion of the face there. So the salivary glands, obviously they secrete saliva. We have 2 parotid glands and 2 submandibular glands and 2 sublingual glands. So you can break those terms down. Parotid, P-A-R, means beside. O-T means ear. So the parotid glands are just in front of your ear. Submandibular, sub means below, mandible, obviously referring to the mandible, the lower jaw, and then sublingual, sub again meaning below, and lingual meaning tongue. So you can identify those glands by breaking down their terms and where they are. So they secrete saliva, which is basically 95% water, but it also contains a bunch of enzymes. Those enzymes are listed there: salivary amylase, lipase, lysozyme. Saliva also contains immunoglobulin A and mucus. So what does all this do? Saliva is very important because it starts the chemical digestion in the mouth, and it also provides some protective functions. So we already said mastication or chewing helps with mechanical digestion. Saliva helps with chemical digestion. So salivary amylase helps to break down starches. Lipase breaks down fats. Lysozyme is an enzyme that helps decrease the growth of bacteria. It's a protective enzyme that decreases the growth of bacteria. Lyso means dissolve, and zyme means it's an enzyme. And then immunoglobulin A gives us a protective function. We'll talk more about that in chapter 12, but it provides a protective function. And then the mucus that's secreted in saliva helps to lubricate the food as it passes down into the esophagus. All right, so let's look at some of these terms. Cusp, again, we said cusp just means that it's a point. So like the bicuspid means 2 points. Lingual, I think I already said, means tongue. Mandibulo or mandibule means the mandible, and salive refers to saliva. So if we're referring to something as salivary, that would be the adjective form of saliva. Okay, so let's look at some disorders of the mouth. Plaque refers to a collection of microorganisms or their products. So you've probably heard of plaques before. Plaques can lead to dental caries, which is just what we commonly refer to as a cavity. Dental calculus, you don't think of calculus like math. Dental calculus, a calculus refers to a stone or a crust of some kind. This is what the medical term for tartar, or the crust buildup on the teeth, which is basically calcified deposits. And these build up along the gingival border, or the line of the gums on the teeth. And that is the very beginnings of dental disease. An abscess is basically a collection of pus, and this can occur anywhere in the body. Any kind of collection of pus is referred to as an abscess. And this refers to, obviously, an infection if it's a collection of pus, but it can be very serious in the mouth. Gingivitis, I think I mentioned this before, is an infection of the gum. And periodontitis is an infection that causes the gums to pull away from the teeth, and it can form pockets if it becomes infected. If it infects the underlying bone, that can be very serious. And pyorrhea can result. Pyo means pus. I think we had the suffix rhea before. It means excessive flow. So if it starts oozing pus, that's referred to as pyorrhea. And stomatitis, we use this for any disorder of the mouth. It's used for any infection of the mouth. All right, so what are some more disorders of the mouth? Mouth ulcers, we commonly refer to them as canker sores. These are erosions of the mucous membrane. Most common type are what we call aphthous ulcers. You can see those there on the inside of the lip. They can occur in clusters, or they can be singular, usually caused by maybe a bacterial illness. They can be caused by stress. They can be caused by hormonal changes. They can be caused by trauma. They're usually pretty benign. They can resolve on their own in 3 or 4 days. Cold sores are also known as fever blisters, and these are recurrent ulcers caused by the herpes simplex virus type 1, or HSV type 1. So these are viral infections that cause eruptions on the lips. These cannot be cured. They come and go. They usually last about 7 to 10 days. You can take antiviral medications to decrease the outbreaks, or there's some topical antiviral medications that may help. They are contagious. The aphthous ulcers mentioned previously are not contagious. However, cold sores are contagious. This is a picture of thrush. Thrush is, I think I mentioned this in one of the skin videos. This is an infection that's caused by Candida albicans. It's a yeast infection in the mouth. It can occur in the mouth. It can also occur on the skin. It can be caused by prolonged use of antibiotics. It can be seen in patients who are immunocompromised. It can be seen in newborns. It can be seen in patients undergoing chemotherapy or who are HIV positive. It can be treated with antifungal medications that you swish around in the mouth and then spit out. Leukoplakia is a white plaque that can be seen anywhere in the mouth. It's common in the elderly. It's often associated with smoking or chewing tobacco. It is benign, however, about 3% of it can turn into oral cancer. And again, it's usually seen in patients who are immunocompromised, such as those with HIV or other immune system disorders. Oral cancer is most commonly seen in patients who are smokers or use chewing tobacco. Usually it is squamous cell carcinoma, usually occurs on the lip or on the tongue. This cancer can metastasize to the lymph nodes, the bone, the lung, the liver, has a survival rate of about 55%. Halitosis is the medical term for bad breath. It can be benign, like just poor oral hygiene, or it can be associated with any one of the disorders that we're talking about here. Glossodynia is a painful burning sensation of the tongue. The root word glosso means tongue, and dynia, the suffix dynia, means pain. It can be associated with postmenopausal women. It can also be associated with a vitamin deficiency. There's no real treatment for it, just mostly symptomatic treatment. Cleft palate is a congenital disorder that results from failure of the hard palate to completely close during embryonic development, and it usually can be repaired surgically and pretty successfully. Sjogren's syndrome, that's pronounced Sjogren's syndrome. This is a syndrome that is an autoimmune disease that attacks the glands that produce saliva and tears. So its symptoms include dry eyes, dry mouth. You also have a lot of joint pain. It's thought to attack the synovial joints, so it causes a lot of joint pain and tenderness. The case study in this chapter deals with a patient who has Sjogren's syndrome, and it's treated very similarly to rheumatoid arthritis. All right, so let's look at some disorders of the esophagus. Esophagitis is inflammation of the esophagus. You can tell by the suffix itis there. GERD stands for gastroesophageal reflux disease. That's the technical term for esophagitis. It's associated with postprandial burning in the chest, or what we call heartburn. Postprandial means after eating, so post means after, prand means meal, so eating or burning in the chest after eating. You may also have pain with swallowing and occasional vomiting of blood or hematemesis. The most common cause is the reflux or backwash of stomach contents into the esophagus. Regurgitation of that stomach contents is sometimes called water brash, and it can occur with what we call hypersalivation, so increased salivation. We'll talk about some of the treatments in just a minute when we get to the pharmacology. Hiatal hernia occurs when the portion of the stomach protrudes. We say it herniates, protrudes through the diaphragm and up into the chest. So a hernia is basically when an organ or a structure pokes through where it's not supposed to be. So you can see in the picture there, the stomach actually pokes through the diaphragm and it's up in the chest. So now basically you have stomach acid up in the chest where you're not supposed to have stomach acid, and it can be very painful. So the reflux of that stomach acid can lead to esophagitis. Sometimes surgical repair is necessary, and surgical repair of that hernia is called a herniorrhaphy. If you break that term down, the hernia obviously means hernia, and orrhaphy means surgical repair. Esophageal varices are very serious. You usually see these in chronic alcoholics. Esophageal varices are varicose veins within the esophagus, and varicose veins are very swollen, dilated, winding veins within the esophagus. They are asymptomatic, meaning you don't have any symptoms until they rupture, and they can cause massive bleeding and hematemesis, and they can be fatal. And like I said, they are a complication of cirrhosis of the liver. You see them a lot in alcoholics or people who are in end-stage liver failure. Cancer of the esophagus arises from the lining of the esophagus. Usually the first symptom is difficulty in swallowing, which is what we call dysphagia, and sometimes a burning sensation in the chest, and usually weight loss because the person has so much difficulty with swallowing. Risk factors include smoking and alcohol use and chronic reflux. So it's not a very common cancer, but one that is very serious. All right, so let's look at some of the suffixes. Itis means inflammation of, ectomy means surgical removal of, osis means condition of, dynia means pain, and ist means one who specializes in, or like a specialist. Some definitions: hematemesis, we had this in a previous video. If you break that word down, emesis means vomiting, hemat means blood. Postprandial, I just gave you this one. Post means after, prandy means a meal, so following a meal. Hiatus, that we refer to that in the hiatal hernia. Hiatus means an opening through a structure. And dysphagia means difficulty swallowing. I did dysphagia in one of my other videos on Blackboard, the look-alike sound-alike words, because dysphagia, difficulty swallowing, also sounds like dysphagia, difficulty speaking. So check that out. All right, and some abbreviations. There's a couple of abbreviations listed in your text. The first three are found in the case study referring to the patient with Sjogren's syndrome. So ESR means erythrocyte sedimentation rate. That's a lab test that looks for inflammation. The next one is Sjogren syndrome antibody A. The second one is Sjogren syndrome antibody B. The next one is white blood cell. The next one is human immunodeficiency virus. The next one is herpes simplex virus type 1. And then the last one is gastroesophageal reflux disease. That's it for this lesson. I look forward to seeing you in the next one. Thank you for your attention.